For generations, the image of a heart attack has looked a certain way, and for far too long, that image didn't look like a woman. But the truth is, heart disease is the #1 killer of women in America. Not a distant threat, not someone else's story, it's our mothers, our sisters, our daughters, and our friends. And today, we are changing the conversation. Joining us are two extraordinary women on the front lines for that fight. Laura Kelly, the development director of the Kentuckiana American Heart Association, and Susanna Blair. She's a specialist in advanced heart failure therapies, VAD, and heart transplant at U of L Physicians. She is working with patients fighting the most critical and complex moments of their cardiac journey. We are so excited to have you both joining us today because this is every day. You deal with this every single day.
Every day.
And what is so shocking too is that over half of women in this country are dealing with some sort of cardiac something, and a lot of people don't even realize it.
That's absolutely right. About 50% of adult women are living with some form of undiagnosed cardiovascular disease. So a tremendous amount of our work at the American Heart Association, especially in Go Red for Women, is getting that education, awareness, and advocacy out so women know what their risk is and know what the resources are for them to treat it.
And you are just 3 transplants away from 1,000.
Well, three LVAD implants.
Yes.
Yeah.
Yes.
From 1,000 for the whole program, for the history of the program. It's amazing.
Yeah. So tell us a little bit about that program.
So I work with the Advanced Heart Failure program at U of L, Jewish, and we see the sickest of the sick heart failure patients. So these are end-stage heart failure patients. They maybe have a peripartum cardiomyopathy, a familial dilated cardiomyopathy, or an ischemic cardiomyopathy from a heart attack. And we see them when really conventional treatments have failed.
Right.
So now we're talking about maybe replacing their heart with a heart transplant, or we're thinking about putting in an artificial heart pump or an LVAD. And we are, yes, 3 away from 1,000. So it's pretty remarkable the amount of lives that we've touched, and every amount of time these people get beyond when they get implanted or transplanted is extra time. And so we've given a lot of people a lot of extra time.
Yeah, it is kind of crazy to put that in perspective, 1,000,
Yes.
but we don't want it to get to that point, and
Correct.
that's why this conversation is so crucial today. And you know, heart disease is the #1 killer of women. So how should we look at heart disease, you know, comparing men to women, how women should be certainly in the forefront of this?
Yeah, so women have a very unique risk profile versus a man. We know that estrogen is partially cardioprotective, and so people that go through menopause early have a higher risk of heart disease. Pregnant women who have complications like hypertension or preeclampsia or type 2 diabetes, they have a higher risk of coronary artery disease later in their lives. So it's important for women especially to talk to their doctors, know their family history, know their numbers, know your cholesterol, know your blood pressure numbers, so that they know if they're at risk, if they need to be on some medications, or if they need to be seeing a heart specialist doctor early before they end up having to see me.
Right, so important. And I think too, you know, women throughout their life, they go through so many different, you know, life cycles. You know,
Yes.
you mentioned pregnancy.
Correct.
Menopause is also a big one,
Yes.
and even beyond. Why is it so important to kind of individualize those groups?
Yeah, so women across the spectrum, they face different risks depending on where they're at, right? So a young woman in her 20s probably doesn't face the same risks as a woman in her menopausal years.
Right.
So we have to just kind of individualize, look at the woman and their risk profiles where they're at.
And we have so many roles as women too, you know.
Yeah.
We're mothers, we're daughters, we do so much, even in the workplace too. We're taking on so much more stress
Of course.
nowadays. So for women balancing busy lives, you know, what are the most practical changes that they could start today?
Really the most practical change is, you know, eating well, drinking your water, avoiding tobacco, alcohol, drugs, trying to get in a little bit of activity every day, take a walk at lunchtime, you know, just try to find 15 minutes of your day. It adds up. Try to take a walk, move your body, and know your numbers.
Know your numbers. That's the big one. And that's what you're really emphasizing for your Go Red for Women experience coming up on June 10th. So excited to be a part of it. I'm actually emceeing the event. But what can people experience while they're there?
And we're so glad to have you there. Yes, knowing your numbers is a huge part of what we talk about as a way to know your risk and understand your relationship to your cardiovascular and brain health. And so you'll have the opportunity that day to have your blood pressure taken. You'll be able to triage with a provider and say, help me understand these numbers, or, you know, hey, my numbers look great, but I know I have a family history of high blood pressure, hypertension, so help me understand what I need to look out for. There are going to be opportunities to engage with different points of our mission. You can practice hands-only CPR, which could double or triple life expectancy for someone who has a cardiac arrest. You can talk about the chain of survival and why our first responders are so important, and how you are the first responder until those first responders arrive. There are going to be so many opportunities to engage.
It's going to be such an enlightening luncheon on June 10th. Tables and tickets are still available. So ladies, thank you so much for stopping by today.
Thanks for having us.
Thank you.
All right, to get your tickets, to learn more, just head over to heart.org.